For decades, the Centers for Disease Control and Prevention stood as our quiet guardian, watching the invisible and holding the line against threats most of us never saw. Its victories were silent yet vast. Outbreaks traced and stopped before they spread, hospital infections prevented through science-driven standards, and vaccination campaigns that spared millions of families from grief. From the foods we eat to the air we breathe, from newborns in nurseries to elders in nursing homes, the CDC shaped an invisible shield that allowed us to live as though catastrophe were distant. It was never meant to seek headlines. It existed so that tragedy could remain unnamed, hidden beneath a steady vigilance that kept us safe. Now that shield has been shattered. In a matter of months, the CDC has been stripped of its leadership, hollowed by mass resignations, and weakened by devastating layoffs that dismantled programs at home and abroad. Its director removed, its senior experts scattered, entire divisions closed, and thousands of staff, disease trackers, lab scientists, outbreak responders, gone. Lifelines like the Epidemic Intelligence Service have been cut. Surveillance systems once tuned to detect outbreaks in days now sit quiet. Where the CDC once led with speed and unity, we are left with fragmentation, uncertainty, and a dangerous vacuum where coordination once lived. The consequences are not abstract. Without constant vigilance, foodborne illnesses will spread further before detection, hospital infections will creep back into ICUs, and preventable diseases like measles, polio, and pertussis, once nearly eliminated, will reclaim their place. Global partnerships that relied on CDC leadership are already faltering, threatening yellow fever, cholera, and polio control abroad, with consequences that inevitably return home. And without a coherent pandemic readiness infrastructure, the next novel virus will find us slower, less organized, and far more vulnerable than we were before COVID-19. We are walking backward into danger, dismantling the very systems that gave us foresight. The truth is simple: pathogens wait for weakness, and weakness has been invited. The dismantling of the CDC is not an act of reform, it is an unmaking of prevention itself. Every outbreak avoided, every illness averted, every death delayed came from the labor of experts who quietly made the improbable possible. Without them, the triads of prevention collapse, surveillance no longer informs practice, practice no longer saves lives, and chaos fills the space where vigilance once lived. What we dismantle now, we will pay for later, not in budgets, but in lives. So we say farewell, though it should not be farewell. We honor the scientists, doctors, and field officers who dedicated their careers to saving lives we will never count. We mourn the silence where leadership once spoke and the blindness where vision once guided. And we grieve because this was preventable, because we chose to turn away from science, coordination, and care. Farewell to the CDC, our quiet sentinel, undone not by pathogens, but by politics. The watchers have fallen, and the storm gathers unseen.